we're going to jump into our first set of content for the day, a presentation on the state of gender-based violence in South Asian communities. Thank you to those of you who remember me bugging you with many emails about the State of the Field survey over the past year. We're so excited to share back. But before we jump in, I'd love to just lead us all in a collective deep breath. So if everyone could just take a deep breath in, 1, 2, 3, and exhale, 1, 2, 3. And with that, I will pass it over to Nashi.
Thank you, Himadri. You were such a superstar going through all that info. All right, so without further ado, welcome to our first presentation, the state of gender-based violence in South Asian communities. So for the next 20 minutes together, we'll be taking a rather brisk walk through some data that will help ground us in where we are in this current moment as a field and as a movement. And we'll be sharing the latest data and statistics from external researchers and the data that you all shared in SOAR's State of the Field survey, which Amrita will share a little bit more about in a second. This is the first time this data has ever been collected and shared about the impacts of COVID-19 on our field specifically. So we thank each and every one of you who supported this monumental and historic effort. And because of you, our field is now equipped with an undeniably powerful advocacy tool that we've never really quite had before. And so while we have limited time in this session, please feel free to engage in the chat throughout this presentation about what's coming up for you, how these numbers are sitting with you. We acknowledge that this is both energizing, but also sobering. So, all right, that I'll just dive in. Well, first, to reimagine in the future, we need to understand our present. So a little recap of our overview. We'll cover statistics on the presence of gender-based violence in our diaspora, and then also, again, share findings from SOAR's State of the Field. All right, now we'll get into some data. So some of this data might already feel familiar to you, but for those of you who are joining us or learning about this for the first time, we'll quickly run through some of these numbers that are really resonant for our communities. So we know that 48% of South Asians in the US are experiencing physical violence. That's nearly half. And 38% are experiencing some form of economic abuse. 35% are experiencing some type of physical violence. And sorry, I think I misspoke, but 48% of South Asians are actually experiencing emotional abuse. And then finally, 26% of our diaspora is experiencing immigration abuse. So I'm going to pause here for a moment to let these numbers really sink in, because no matter how many times I see these numbers, it's deeply sobering to see nearly half of our diaspora being impacted by gender-based violence. And as we all know, these rates are likely not capturing the full extent to which these different harms are occurring because of underreporting and how difficult it is to collect data in this field to begin with. So just want to put that asterisk on the numbers that we're sharing. I'm gonna quickly just touch on this. So another survey in 2016 found that 41% of South Asian respondents experienced child sexual abuse and 25% witnessed domestic violence in their homes as children. So really kind of touching on this idea of generational violence, which brings us to our next number. 85% of South Asians aged 18 to 34 have experienced some form of sexual assault. And we can talk about these numbers in so many different ways, but what I can't help but see is the grip that generational violence has on our communities, and with young people bearing some of the greatest burdens of that. And while we'll discuss this later today, it feels important to note here that any change we drive to break generational violence must also actively cultivate change that moves us towards generational healing and violence-free communities. All right, so with that, I'll pass it to Amrita.
Beautiful. And I just wanted to note that everything that Nashi just referenced is linked at the bottom of the handbook. and my apologies, the statistics on the first slide were incorrectly written. The numbers were right, but matched with the wrong form of violence. So if you want to reference the correct ones, they are linked below and they've been fixed in the slides in case you're following along. Alrighty, so as Nashi laid out, this is what we know from external research. And honestly, I mean, folks, we've been collectively sort of referencing statistics from 2002, but we actually now have these updated statistics from 2020 to 2022. But now what we're going to go into is what we learned from all of you. So kind of internally looking at our field. Do you want to go to the next slide? In early 2022, we launched what we called SOAR State of the Field Survey. That was launched in February 2022, created by the SOAR team. And I just wanted to special shout out Bhavika and Rachna for their support on that. And with Hamadri's additional support, we were able to collect 26 responses by the end of the summer. Those 26 responses came from 11 states across the US, and you can see that map here on the right. We collected those responses on SurveyMonkey, and once again, thank you so much to all of you who filled that out. My next slide kind of talks about why we know that we couldn't get to 100%, and that's okay. This is a starting point because data collection is challenging. So many of you don't even, we don't have the capacity, the infrastructure for this data to be collected, to be reported, and then let alone to ask, you to fill out a survey that is very long and cumbersome. So once again, our gratitude to those who went through it. It's really going to help us provide the starting point for our collective advocacy. With that, I wanted to name a couple of the limitations that we encountered. That's always helpful to understand what data we're looking at. So firstly, we all know this, we just define terms and we count things differently. That ranges from everything like community engagement activities to attendance to helpline calls, and of course, how we consider or think about clients. Secondly, we all collect different data points. So in some instances, you might have more information than others. In some instances, you might have less. For example, religion, immigration status, gender, sexuality. These are all things that vary across our organizations. And lastly, our work is complex. Folks experience different forms of violence. They hold, all sorts of complexities in their own identities. So when we think about these numbers, when we think about the demographics, just want us to collectively, embrace that there's a lot of complexity here that we won't capture through numbers, but that's what the rest of the summit is for, to unpack those numbers and provide the stories and layers that are behind what we're seeing on the screen. So we're going to start with the basics. And again, a big asterisk on the basics, because these are far from easy to count. And we'll get into why. So as I was mentioning, we all kind of define and think about things differently. So first off, what do we consider to be a helpline call? We were able to analyze the responses that you all provided for what you actually included in a helpline call, or that number. 85% of you include phone calls, 75% include internet-based connections, that's email, a social media DM, or requesting support. 50% include direct inquiries, so that might mean someone coming to your organization, coming up to you at an event, or directly calling you. Or emailing you, sorry. And then 30% include referrals from staff or other organizations. So now let's look at the number of helpline calls between 2019 and 2021. Again, just keep in mind all the limitations I provided, but we do want to kind of note, and I'll note this is in the thousands. So 2019 and 2020, we're seeing about 37,000 total helpline calls across 26 organizations. In 2021, we get to 43,000 helpline calls. And again, that includes emails, DMs, all the ways that you might consider someone reaching out for help. And this isn't a surprise, because it mimics what we know, or it mirrors what we know already, which is that after the lockdown or after a certain period of isolation in the pandemic, violence both increased, but also folks had access to actually reach out for help that they didn't have access to in certain moments or parts of 2020. All right, and now we'll go on to clients. So who do we consider to be a client? Just a big asterisk on the word client. So obviously the term that we use when we're reporting or referring to the folks that we serve, but they're individuals, they're people, they're survivors, they're family members. So 71% include primary clients. That is the individual who, maybe made the first call or is the primary client that you're serving the survivor. 33% include secondary clients. That might include a child, a family member, another partner of the primary client. And then 50% include clients who received any service. And all of your organizations, I think a majority of them are multi-service, which means someone might be receiving legal advocacy services, but maybe they're not receiving counseling or vice versa. So just a huge range in how we think about this, but also, as I mentioned, really a reflection of the complexity of who is a client and the services that we offer. I think this is a good pause point right after the next slide to take a quick question. So Nashi, if you want to go. Collectively, how many clients did we or you serve between 2019 and 2021? You can see the numbers on the slide. There is a huge jump between 2020 and 2021. I think we do have some digging to do around why. But as I mentioned, it very much mirrors the 40% increase in GBV that we know occurred during the pandemic. And yeah, before we go on, Rachna, if you want to share your comment either quickly aloud or in the chat, either one is fine, and then I'll pass it to you.
Sorry, it's going to be faster if I just say it because I was confused. Can you go back 2 slides for me? Right there, is that 71% include primary clients only? So we're saying that 70, is that what that?
Perfect. Yeah. Thank you for making that clarification.
That's it.
71%. Yeah. Include primary clients only. Thank you.
Okay. Got it. Thanks.
All right, thank you for that clarification. So let's dig a little bit deeper about who exactly these clients are, what communities and identities are they a part of. We'll just dive right in. All right. So first, what types of violence are your clients experiencing? As you all know, there are several types of violence in our field that we're confronting simultaneously. And this is a visual representation of our battlefield, essentially, with the sizes of each circle representing how prevalent that form is relative to one another. And this violence isn't experienced across any one age range, as so many of us know. Violence is occurring across our diaspora's lifespan, with 10% experiencing violence by the age of 17, 18% between 18 and 24, 36%, which is the largest number you see here, affecting folks who are 24 to 49 years old, et cetera. And we know our diaspora is far from monolithic and experiences deep inequities across language access, immigration, and economic opportunities, which is what the next few slides will illustrate. But this first slide is, what languages did all of your organizations have the capacity to provide services in 2021? And across our collective, we are providing life-saving support, or rather you all are providing life-saving support to survivors in 22 languages. That's incredible. And we know that over a third of the survivors you serve are non-US citizens, which we know carries distinct challenges, especially in the wake of the Trump administration. Knowing that nearly 26% of our diaspora experiences immigration abuse, that makes it all the more important to ensure that barriers like multi-year wait lists are eliminated so that survivors can access timely and secure pathways to citizenship, independent from their abuser. And nearly 40% of the survivors you serve are unemployed or underemployed. further demonstrating how unsupported survivors are in the workplace. These inequities, which are due in no small part to patriarchy and capitalism, fuel financial dependency, making survivors vulnerable to financial abuse, among other abuses. And this is yet another reminder of how important it is to support our communities with equitable economic and financial resources. I'll pass it to Amrita to close us out with some more slides.
Perfect. I just wanted to address some of the things in the chat. Rachna said this stat is interesting because of overall sort of like nationwide data on age ranges that are most commonly abused by an intimate partner. I think that's interesting and definitely a lot to dig into. Yeah, as you mentioned, like the clientele that normally come to GBV to our GBV organizations and who we may be missing as well. And then Preet, to your question, there are actually several client demographics that were reported on that we're not sharing today. And Nashi will talk a little bit more about when we plan to share, but caste is not one that we collected because I think that's something that folks don't ask for because, or not every organization collects because it's not a requirement or necessary to provide services. And that is generally a challenge we ran into in asking for standardized collection of demographics. Switching gears a bit, we're going to go into what services you're providing. And once again, this is a snapshot. It's not the full picture and breadth of services, and there's a lot more data where this comes from. So first off, we thought we'd feature counseling and mental health because that is such a high need, and many of you are potentially facing wait lists or shortages, or just growing your mental health and counseling services rapidly as well. So the statistics on the right, on the left, sorry, you can interpret as what folks offer in-house. So 65% offer group counseling and support groups in-house, 65% of organizations offer individual counseling in-house, and 46% offer parenting support in-house. This was actually a surprise to me. Maybe I just wasn't aware of the level of parenting support that is provided, but certainly really incredible. And I think, maybe a discussion to be had about how that actually is leading is part of a broader prevention effort as well. But also notably, 30 to 50% of counseling and mental health services are referred out. That means you might be partnering with someone in private practice, you might be partnering with the county, or maybe some other mental health support group, which feel free to drop in the chat, like if you have any observations about who you're commonly referring out to. And next, we thought we'd highlight housing, transportation, and food. You'll see in the emerging trends from this year, there are a lot of increases in these basic needs. And I think a lot of that is due to many of you expanding your services during COVID. So 85% of organizations provide direct rental assistance for housing. 75% of you provide gift cards, cash, or some sort of passes for public transportation or other transportation. That could even be like a ride share. And 38% of you provide meals or meal deliveries. I feel like, like I said to the right, that doesn't account for food banks, gift cards for groceries. There are so many different types of food services that are offered, but just wanted to highlight this one. And I'm going to answer a question that came to me as a private message. These statistics that we're sharing came from 26 of the 32 SOAR member organizations. Earlier in the slides, in case you joined late, you can see sort of the geographic distribution of where those services where those responses came in from. But just to reiterate, it's from 26 of the 32 SOAR member organizations. So several of you. Perfect. And then I think, yes, our next section is on to, as Nashi mentioned at the beginning, how did COVID-19 impact your organizations? So on the left here, we have two quotes, which is one I already kind of alluded to. COVID has allowed us to become clearer on the role we play for our community during moments of crisis. I think this was likely a transformative set of years for many of you, as Deepa mentioned, in terms of how you show up for your community and what survivors and their families need from you. But secondly, and highly important, is the biggest word in the word cloud on the right, which is an analysis of all the written responses that came in. And I think what's important to note here is that staff is the largest word on here, which means that the folks that who COVID took a toll on was you. And that's also something Deepa mentioned, and that we're still working through and still coming out of and still seeking a way forward to resolve. And to just build better infrastructure for ourselves to be able to manage this toll, to care for each other, and to build a sustainable working environment and field. Actually, if you want to go to the next slide. And the last thing sort of in this section before we go to the most recent data is budgets. We did collect a bit more information here, but I just wanted to point out a couple of things. In 2021, the sum of the budgets of 20 organizations, so only 20 out of the 26 we surveyed submitted data here, was right under 25 million. But the budgets ranged from 8,500 annually to 4 million. And this reflects a question and conversation that has come up very often in the SOAR space, which is we're a collective movement, our organizations serve the same demographics, but we are on a such wide spectrum in terms of the size of our staff, the size of our budgets, the length of our existence, even the nuances of the communities we serve. And one of our aims today, even throughout the session, is to really make space for learning and connecting across those different organizational sizes and types, because I think that mentorship and that sharing is really where our collective sort of strength and capacity thrives. And so finally, I'll end with what trends we're seeing right now. If you want to go to the next slide, we asked you all in your we kind of did a twofer, and we asked you in your registration form to share your most recent trends and also the total number of clients served. So I'll pause here because, as you can see, the range on the left is massive, ranging from around 5,500 to 21,000. Our team, just like so you know, aims to unpack and sort of understand if we can get to more clarity here. But this is really a reflection of folks and all of us counting these numbers differently and counting them differently across programs within a certain organization as well. So instead of providing an average, we just decided to provide you with a lower limit and upper limit of the number of clients that you all reported. So for example, just to give you a sense or context to why this range is so wide, even within one organization, when we asked how many clients did you see in 2022, it could have ranged from 250 to 7,000. Our assumption is that we were probably not clear enough in clarifying that that was clients and maybe not helpline calls, or maybe not the combination of both. But certainly something to unpack, and we just wanted to be transparent about this range here and doing our best to collect this number nationally. And on the right, just wanted to point out a couple of trends that we hope you keep in mind as you go through today, thinking about, sorry, that's my buzzer if you can hear it. The first is clientele, more folks from diverse populations seeking services, including men, youth, and LGBTQ and queer folks. Clients coming from outside the traditional catchment area. We've been hearing a lot about referrals and phone calls coming from different states, and all the more reason to refer and connect with one another. Second is the obvious increase in DV and sexual assault that we've kind of known as a movement. And specifically, as I mentioned, the need for mental health support. Trend 3 is around services, and as I mentioned already, more challenges accessing these basic necessities and likely a higher need for them as well coming out of the pandemic. And also, probably to no one's surprise, an increased demand for legal and financial aid, which several of you provide and is one of your primary services. And like I mentioned, we didn't share the data on that, but we have the data on services provided. And lastly, thanks for sticking with me through this, community. And this is actually where our summit ends today later today with community. But an increase in requests for community outreach and educational programs. So that's something we'd love to hear more about and get more color on and give you the space to share with each other as well. Alrighty, I think that's it for us and the data. I'm gonna pass it back to Nashi. And we have, I think, a couple of minutes. Nashi's gonna share a bit more about our plans, and then we'd love to turn it to you all.
Yeah. So what we shared today is, again, just a glimpse of what we hope to dive deeper into and publish in the summer of 2023. So we didn't cover all the data points that we asked you within the SOTF survey, but we'll be doing hopefully a deeper and more expansive view of that and providing that to you all in just a few months. And in the meantime, you will or already have access to the data that we shared today. So again, what we shared was driven by you. And while this information was sobering in many ways, as you all kind of uplifted in the chat, we hope you feel proud about what our collective was able to achieve by producing this data. But more importantly, how our collective has continued to show up for survivors in our diaspora against extremely difficult odds. So our hopes are that this becomes an advocacy tool for you to lean into the strengths that we named today, and that you all have so clearly demonstrated for decades, and also address the gaps affecting our movement and communities. Okay, perfect. So I'm glad we have a few minutes for comments and questions. So I'll pause here and feel free to unmute, but also share questions in the chat.
I had a question. First of all, this was really helpful. So thank you so much for collecting all the data. Very helpful. Question, I kind of mentioned in the chat, I think it would be helpful to kind of also capture data or who is not being served. People who may be falling, who are falling through the cracks, people who may be partially served because the agency has some gaps in services or capacity issues. Referring out means different things to different people. Are we referring out because we don't have the capacity, ability, or that service to provide? Or we have an MOU with a partner and the external partner or a collaborator is providing that space? Just to kind of flag that it's just as important for us to capture data on who is not being served and where the gaps in services are for the agencies as it is to capture who we are serving. That's all, but thank you so much.
Thank you, Navneet. I'm just going to jump in. Sorry, I think we're both trying to manage the chat as well. And I just wanted to touch on Manisha's question, will the data be collected annually? And kind of to Navneet's point as well. I think we want to spend time with all of you and understand, like, what are your challenges to reporting this data, even to us? What's your challenges with collecting it, so we can figure out a sustainable way to collect this? Is it every year? Is it every 5 years? What are the time points and what are the best ways to do that? So I think that's an open conversation that we all want to invite you all to share with us. And I think that takes us to our break. Just a note, every chat that is coming in, we are taking, account of, and we will make sure to share back if we have a response. But yeah, for now, passing it to Himadri to lead us into our break.
Thank you